My name is Dr. Alyssa Snider, and I'm a certified genetic counselor at iGenomics. I have a master's degree in genetic counseling and also a PhD in genetics. Today I'd like to talk to you about pre-implantation genetic screening, or also called PGS testing. During a genetic counseling session, we talk about what PGS is, what's tested for, and what the limitations of PGS testing are. Let's talk about the process of PGS testing. In order to test embryos genetically, embryos must be created through a process called in vitro fertilization, or IVF. A small biopsy is taken from the embryos and sent to iGenomics for testing. It's important to remember that all of your medical care and all of the handling of the embryos occurs at your fertility center. This includes the stimulation medications, the egg retrieval, the fertilization of the eggs, and the culture of the embryos. Your IVF center will also perform the biopsy of the embryos, in which between 2 and 10 cells are removed from the embryo and placed into a tube. That sample will be sent to iGenomics for testing. Testing takes 7 days. A report will be issued directly to your physician, and you and your physician can use that information to decide which embryos should be used for transfer. Embryo transfer can take place the next cycle or a subsequent cycle. The purpose of PGS testing is to help you and your partner have a healthy baby. PGS testing is often offered to women who are 35 years and older, to couples who have had multiple pregnancy losses, or when one of those pregnancy losses is known to have been caused by a chromosome abnormality. PGS testing may also be offered to couples who have done IVF multiple times and have never conceived a pregnancy. There are many benefits to PGS testing. One of the benefits is that it can help you get pregnant. It increases implantation rates. Another benefit is that it can decrease the chance of miscarriage and increase the chance that a baby will develop to term and is born healthy. PGS testing can also help women get pregnant faster by identifying embryos that have normal chromosomes and have the best chances of having a successful pregnancy up front before transferring embryos. Aneuploidy is when an embryo has a chromosome abnormality. The chance that an embryo has a chromosome abnormality increases as women get older. You can see in this chart here some examples of aneuploidy rates for different categories of women's ages. For example, for women who are between the ages of 30 and 34, each embryo has about a 52% chance of having a chromosome abnormality. For women who are between the ages of 35 and 39, each embryo has about a 62% chance of having a chromosome abnormality. For women who are 40 years and older, we find that each embryo has about a 76% chance of having a chromosome abnormality. A report will be sent directly to your physician. Each embryo is tested individually, and each embryo will have information listed on the report. Most embryos will receive a definitive diagnosis. These diagnoses could be normal, abnormal, or complex abnormal. Normal means that there's a correct number of chromosomes present in the embryo, and this embryo is a good candidate for transfer. Abnormal means that there is an extra or missing chromosome, and this embryo is not recommended for transfer. A complex abnormal result means that there are 5 chromosomes or more that are extra or missing. There is also a chance that an embryo could have an indeterminate result, which means we don't know what the result is. This can be like not having done PGS testing, and you should speak with your physician about next steps and whether or not this embryo could be used for transfer or not. Depending on the way the embryos look, it may be possible to retest the embryo. Most of the time, there will be some embryos that are normal and some embryos that are abnormal. It is also possible that all embryos will be normal, and similarly also possible that all embryos will be abnormal and there will not be any embryos recommended for transfer. This typically occurs by random chance, and we don't know what the results are until we do the testing. Those who are doing PGS testing will want to know, what is it that we test for? PGS testing is a chromosome count. We're looking to ensure that the appropriate number of chromosomes are present, and we look for any gains or losses of chromosomes. There are 23 pairs of chromosomes, 46 in total. Any one of them can be extra, or any one of them can be missing. The vast majority of these chromosome abnormalities are not compatible with life, which means that embryos with extra or missing chromosomes can't grow or develop to term. There's a short list of exceptions where embryos with chromosome abnormalities can develop to term, and these babies are born with genetic syndromes. An example of one of these genetic syndromes is called Down syndrome, which is caused by having an extra copy of a chromosome. But remember, the majority of chromosome abnormalities that PGS detects are not associated with genetic syndromes that can be seen in liveborns. Therefore, it's not recommended that you go onto the internet and Google the abnormalities that are found on PGS testing. There's extremely limited information on the internet about extra or missing chromosomes because babies are not born with the majority of these chromosome abnormalities. Embryos with normal chromosome results are the best candidates for transfer. They are the most likely to implant, most likely to develop to term, and most likely to be born healthy. Any embryo with normal chromosome results are good candidates for transfer. An embryo with a chromosome abnormality is not recommended for transfer from iGenomics. These embryos are not recommended because they're not likely to have a successful pregnancy. Embryos with indeterminate results are also not recommended for embryo transfer because we don't know what the outcome of transferring these embryos can be. You and your physician should discuss together the results of the PGS testing and together decide which embryos will be used for transfer. Let's talk a little bit about what PGS testing does not test for. PGS testing does not test for birth defects directly. While many of the genetic syndromes that PGS tests for are associated with birth defects, most birth defects are not caused by chromosome abnormalities. Remember, most babies are born healthy, we just can't guarantee that based off of the PGS results. One thing that's important to note is that PGS does not cause birth defects. Many people are concerned about the biopsy procedure, where between 2 to 10 cells are removed from the embryo. Embryo biopsy has been performed for over 20 years, and there's been no documented increase in miscarriage or birth defects. There are some risks to embryo biopsy, and the risk is that the embryo may not survive. That means that there's a chance that you may lose an embryo during the process and not have that embryo available for transfer. However, the vast majority of embryos do survive embryo biopsy, and of those embryos that do survive embryo biopsy, we expect normal development with no increased chances of birth defects or miscarriage. PGS does not test for inherited genetic syndromes. Remember that some genetic syndromes are caused by chromosome abnormalities, but these are random and spontaneous and not caused by changes in the genes. PGS cannot test for single gene disorders such as cystic fibrosis or Tay-Sachs disease. PGS also cannot test for autism. Autism is caused by a variety of different genetic factors, and we often don't know what the causes are. Therefore, it's not possible to rule out autism in an embryo. PGS also cannot test for adult onset conditions like high blood pressure or diabetes or Alzheimer's disease. PGS also cannot test for traits like hair color, eye color, height, or intelligence. PGS testing is 98% accurate. This means that while PGS test is a very good test, it's not perfect, and there remains some inaccuracy with PGS testing. For example, an embryo could be diagnosed as normal when in fact it's abnormal. There's also a chance that an embryo could be diagnosed as abnormal when in fact it's normal and would be a good candidate for transfer. The chance of this happening is low, but we can't rule it out because of the way that embryo testing is performed. Remember, only a few cells are tested, and we can't look at the whole embryo. An assumption is made that the cells that are tested represent the whole embryo, and the vast majority of the time, this assumption is correct. Occasionally, this assumption is not correct, and that can lead to a misdiagnosis. Because of this chance of misdiagnosis, prenatal testing is recommended to follow up with the PGS test results. This means that when you're pregnant, you should talk to your OB about the genetic testing that's available to you to check for chromosome abnormalities. You can discuss with your physician that Down syndrome was tested for on the PGS test, but remember that the PGS test is not perfect, and follow-up testing is recommended to confirm the results of PGS testing. There are different types of prenatal tests that are available to you, and you can speak with your physician about which test is most appropriate for you. iGenomics recommends amniocentesis or chorionic villus sampling, or also called CVS sampling, because these are the best tests to do diagnostically. Their accuracy is greater than 99%. However, not everybody wants to do amniocentesis or CVS because these are considered invasive testing, and there is a slight increased risk of miscarriage. This risk is low, but not zero. There is an alternative type of testing that's non-invasive. The non-invasive testing does not have an association with an increased risk of miscarriage. However, the non-invasive tests are not as good diagnostically, and there is also a chance of a false negative or a false positive result. We've covered many of the frequently asked questions that people like to know when doing PGS testing. We hope that you found this information useful, and if you have any further questions, please don't hesitate to reach out to a genetic counselor at iGenomics. Thanks for listening, and good luck on your fertility journey.